UK Allied Health Professions Public Health Strategic Framework, which will take us forward to 2030. It's unique in working across the 4 nations as an AHP community, and we have with us today a full complement of AHP government leads, which demonstrates the collective commitment. We're also delighted that Richard Evans from the Allied Health Professions Federation and William Roberts from the Royal Society for Public Health are also joining us. I'll just outline the morning's programme, which reflects our aims of the session. We'll begin with highlighting our journey so far with Linda Hindle, the Deputy Chief Allied Health Professions Officer in England and an amazing public health lead for many years. And then we'll be outlining the process that we've taken over the last 15 months to reach this point today. Linda will be doing this on behalf of Julie Lowe, who's a public health registrar trainee and an AHP who sadly can't be with us today. And it's a huge thanks to Julie for a lot of this a lot of the work involved in putting this together. We'll then have our government leads and guests sharing their reflections and support and how it aligns with their ambitions within each 4 nation. And then finally, some steps to make it a reality and see how you can get involved. In terms of housekeeping, just a few little things. Because it's a webinar style, your microphones will be muted. But we do have a Q&A session at the end, so please use the Q&A function to post questions during the morning. And Kyle, our student rep, will be curating this to put together at the end of the session. And then finally, we'll have some next steps to make this a reality and see how you can get involved in the future of AHPs in public health. Just quickly to say the session will be recorded and available in your individual nations, and it will be disseminated via your public health leads. So this just leaves me to say, enjoy listening. We've got a packed programme, and hopefully it will inspire our future in improving population health and wellbeing. Over to you, Linda.
Thanks ever so much, Judith, and thanks for your kind words. So, Raggy, if you're happy to move the slides on. The first part of the next one as well, yeah, brilliant. The first part of my session is looking back at the journey that we've been on as a group of AHPs across the UK around public health, because we're not starting from the beginning, and we thought it'd be really helpful to share with you, I suppose, why this is so important, why we're so well placed as AHPs and what we've achieved so far. So if we move on to the next slide, please. We know that we're really well placed to be part of the public health workforce, and this is partly because of how many of us there are. 280,000 AHPs and AHP support workers in the UK. So that equates to a lot of contacts with members of the public and communities, giving us great opportunities to engage around public health and health inequalities. And of course, as you well know, we don't just work in the NHS, we work right across the system, across all of the clinical specialities, across the life course. And because of that, we have the opportunity to contribute to pretty much every public health priority. And moving on to the next slide, please, Raggy. It's also about how we work as allied health professionals. The majority of us will routinely incorporate questioning around healthy lifestyles and well-being within the assessments that we do. Often our interventions will be over a slightly longer duration than some other healthcare professionals, which really gives us an opportunity to develop a relationship and rapport with our clients, which opens the door to conversations about broader health and well-being. And in the majority of cases, we provide care in communities and closer to home. So we're really well placed to be a significant part of the shift towards prevention. So moving on to the next slide. Back in 2019, we published our first UK-wide AHP Public Health Strategic Framework. Prior to that, there had been work on this agenda within the individual nations, but this was the first point that we came together across the UK. And the reason we did that was because most of the partners that are critical to this, so obviously the professional bodies, but also the regulators and the Council of Deans for Health, were working on a UK footprint. And even though the nuance of some of the priorities for public health might have been slightly different within each of the nations, the actual actions that were needed by allied health professionals and the actions that we needed to take more strategically to support allied health professionals in public health were the same. And that's why we decided to work together. So moving on to the next slide, please. Raggy. So these were the goals of our previous strategy. So we wanted to develop the workforce to ensure that we had the right skills for working in a public health context. We wanted to be able to demonstrate the impact of what we do already and what we could do. We were really keen to raise the profile of the role of allied health professionals in public health, and to ensure that we were at the right tables so that we got the right strategic connections and leadership to be in the right spaces where we were the ones with the skills, in particular public health priorities. And we were also keen to focus on the health and well-being of the workforce. So those were the goals that we set. And if we move on to the next slide, there were lots of actions that we needed to take, but we were really keen to make sure that we could monitor whether or not we were successful in this. So for each of those goals, we looked at what would success look like, how would we measure it, and what would be our specific target. So we chose one or sometimes two targets for each of the goals that would act as a proxy measure of whether or not we'd made progress in that goal. And that's how we framed the impact report of this previous strategy, which was published by the AHP Federation on the 8th of January. So if we move on to the next slide, please, Raggy. This is the impact report, and you can find that, as I say, on the AHP website, and I'll put it in. We'll put it into the Q&A section so that you can see the link for it as well. So I'm just going to take you through those 5 goals and the impacts that we achieved before we move on to the new strategy. So on to the next slide, please, Raggy. So our first goal around the workforce, we had 2 targets here. So our first one is that we wanted to make sure that public health was really embedded into pre-registration education, including practice-based education. So our target for this was that all HEIs would be incorporating public health by 2025. And we measured that by a survey that the Council of Deans for Health did for us last year to every HEI course. And we had a 79% response rate from that. And of those, 100% were including public health in pre-reg curricula, which is incredibly positive, because when we did that measurement in 2015, it was only 28% of HEI courses. So that feels like a real progress. Clearly more to do in terms of supporting educators and how we develop the content, but that's significant progress. The other priority in this area was, how do we ensure that there are defined roles for AHPs to advance their practice in public health? So our target was that we wanted a minimum of 50 allied health professionals enrolled in programs which were designed to demonstrate advanced practice or leadership in public health by 2025. We had hoped to have established advanced clinical practice programs, and we have developed a credential to support that. But because of the pandemic, this one was delayed more than we would have liked, but it is ready to go, and so this will definitely be a target in our next strategy. But that said, we still have achieved that goal of 50 AHPs, because we've had 21 who've done population health fellowships. We've had 12 who are on the specialist public health training programme to become consultants in public health, and over 20 AHPs who've done clinical fellowships, which have had a very strong public health focus. And I'm sure we've had many, many more who are doing master's programs, and in fact, a master's in public health programs being developed specifically for AHPs, which is amazing. So moving on to the next slide, please, Raggy. I just wanted to share a few of the publications in relation to this goal. So one is by the Royal Society for Public Health, which looked at expanding placements, clinical placements. Clearly, this is important not only for kind of placement expansion, which we know is important more generally, but also for exposing students to and learners to the wider health inequalities and community-focused public health early on in their training. We were delighted that the HCPC have incorporated specific public health standards into the standards of proficiency. We refreshed the Council of Deans curricular guidance for how to incorporate public health into pre-reg curricula. And there was this wonderful publication around how do you incorporate public health into support worker programs. So moving on to the next slide, our second goal was about how we demonstrate impact. So we did this through research and publications, and we wanted as a target to have a minimum of 3 published reviews about the impact of allied health professionals on public health priorities. So we've managed to get 4 systematic reviews that have been published, plus lots of other research. So those are all in the impact report, the links to them, but they were around the impact of allied health professionals on obesity in early years, the impact of AHPs on public mental health, our impact on health inequalities, and international approaches to public health by allied health professionals. So moving on again, please, Raggy. To the next slide, if we can, Raggy. Lovely, thank you. So our third goal was about increasing our profile. So how do we raise the profile of AHPs? And our target here was that we wanted 100 case studies published by 2025. So again, thanks to many of you probably in the audience who have submitted your work. We've got well over 100 case studies in a variety of places, mainly the Royal Society for Public Health AHP hub, but also some on AHP Scotland and a public health placement space on NHS England's website, and finally some on the Advancing Healthcare Awards website. So they're examples across the professions and across the nations, which is fantastic. So on the next slide, I just wanted to flag the Royal Society for Public Health AHP hub for anybody who might not have seen it, because this is a place where you can go for lots of resources about guidance. Our new strategy will be on there, and all of the case studies are there as well. So that's definitely a place to go if you want further information. And moving on to the next slide, in this goal, I particularly wanted to draw attention to the profession-specific descriptors of public health, which are again on the Royal Society for Public Health website. I've only put pictures of a few of them on there just because of space, but we have one for each of the AHP professions. And this talks about kind of the nuance really of the specific ways in which people from that profession will address health inequalities. So moving on to the next slide, this is our third goal, the fourth one actually, I think it'll be. Thank you. Yeah. So this one was about strategic connections and leadership, and we wanted to ensure that we got evidence of HPs being strategically engaged in shaping the public health agenda, both locally and nationally. So we were aiming for 20 high impact examples, and we've got well over 25. So I definitely encourage you to look at the impact report in relation to this. So they range from, vision screening, communications, obesity, diabetes, screening, loads of really great examples of where AHPs have been at the forefront of national strategic documents in relation to public health. So moving on to the next slide, please, Raggy. This was our goal around workforce wellbeing, and we were really keen here that we wanted to be able to produce a publication that demonstrated AHP's skills and expertise and how we contributed to public health. So this was a piece of work that was led by Wales on all of our behalves, and was published by the Royal Society for Public Health. So moving on to the next slide, please, Raggy. Thank you. Yeah. So just to conclude in relation to this part, we feel that we managed to achieve what we set out to do 5 years ago, and that has primarily been because of the ongoing collaboration between all of the organisations involved, the professional bodies and the 4 nations, and obviously the organisations that support us along the way. So massive thank you to all of them. What we've tried to do over the last 5 years and going forward, really, recognising that there's not lots of resource in relation to this, either at local or national levels. So we've tried to make sure that we've used our resources once on behalf of everyone wherever possible. And we feel that this current framework has supported us to drive more focus around public health for AHPs, and we can see that in the work in the impact report from the professional bodies and the national initiatives. Obviously, we need to maintain this momentum. It's as we'll hear kind of later on in this morning, it's a growing priority, and we hope that the new strategy will provide us with the vision and the roadmap to do that. So I think that's the end of that bit. And as Judith said, unfortunately, Julie Lowe is not able to join us as planned. So Julie really held the pen on developing the new strategy, and she also did all of the analysis to support the development of the new strategy. So massive shout out to her. But yeah, I'm going to cover what she would have said. So if we move on to the next slide, which is the launch of the new strategy. Thank you. And moving on again. So this new strategic framework, 2025 to 2030. Raggy, if you can move on to the next one, please. Lovely. Thank you. So when we were developing our new framework, there were some, I suppose, principles that we wanted to ensure we applied to this. So clearly it was really important that this was going to be applicable to all of the professions and across the UK. But we wanted to make sure that we were learning from and building on the work that we'd already done in our previous framework and collaborations. And we wanted to make sure in setting our priorities that we were including the perspectives from the public and also from AHP teams across the UK. And we were clearly really keen to ensure that we were looking to the future in terms of what were going to be the public health priorities for the next 5 years and beyond. So moving on to the next slide, please. This is the process that we went through to develop our new framework. So we started off back in November 23, where we held a workshop with all of the professional bodies, the 4 nations, and we were supported by public health colleagues, including William, who's going to be speaking later, from the Royal Society for Public Health, Chief Exec, and also Professor Kevin Fenton, who's the president of the Faculty of Public Health, to look at kind of what the future priorities were. And we were also really grateful to hear from Janice St John Matthews, who led the crowdsourcing for AHP's Deliver, the AHP strategy for England. And part of that process involved a lot of engagement with members of the public and inclusion health groups. So rather than repeating what Janice had done, we wanted to learn from what she'd heard from members of the public. So during that first session, we developed themes of what would be priorities going forward. And then between March and April 2024, we ran a survey with allied health professionals to look at some of those themes and to get a wider perspective on those, which I'll fill you in on that in a moment. We also then had a working group, so thank you very much to the strategy working group and an advisory group, and we did lots of testing kind of between May and September as we gradually developed the strategic framework. So we finished the written part in September, and then the final few months of last year were getting all of our organisational clearance and design. So moving on to the next slide, please, thank you. So these were some of the themes that came up in the original workshop that we did back in November that felt to be important for this coming 5 years. So developing the workforce was felt to be still a priority. But there was a growing emphasis on environmental sustainability and the interrelationship between the environment, public health, health inequalities. And also a need to focus on the relationship to economic sustainability and what was the kind of the return on investment of focusing on more upstream prevention work. There was a keenness to ensure that we were appropriately using data and intelligence to inform how we design services, and then a focus around social justice and the social determinants of health inequalities and advocating for communities. A need to look more at innovation and scale and how do we ensure that we're sharing good practice and supporting its implementation. A need to continue focusing on raising the profile of AHPs, on leading and influencing. And then we had a big discussion about have we got a shared narrative for public health and prevention? And did we need to do more about a common narrative in that space? So moving on to the next slide. What we did next was the survey, and we decided to split that into two areas really. So one was the narrative and how we describe public health for AHPs, to try and learn from everyone and get some framing for public health and prevention that really worked for us. And then also to test out our thinking about the priorities for the next 5 years. So we had over 1,500 AHPs respond. So if you're on the call and you responded, thank you ever so much for taking the time to do that. And particularly because the average response time was 31 minutes. So it wasn't a quick tick box. People were really thinking about this and we're very, very grateful for your time to do that. So we had representation in the survey from across the UK, from all of the regions of England, from all of the professions, and from across the AHP community, so students, support workers, registered AHPs, and across all sectors, so not just working in the NHS, working in health and justice, education, social care, etc., independent sector. So moving on, please, Raggy. Thinking from the narrative point of view, then this is what we heard. So we asked the question: if you had to describe to other people how your AHP role relates to public health and prevention, what would you say? And what we were trying to do was to kind of find where the common language was and whether we could use that in our framing of public health and prevention. What we heard, though, was really diverse descriptions of roles and how they're related to public health. A lot of the responses were related to how AHPs interact with individuals as opposed to our work with communities and populations. And there wasn't really an obvious consensus about language or a consistent use of language. There was widespread reference to health promotion and educating patients about how to look after their own health. There was a lot of reference to prevention and preventative health care, and to maintaining function and improving quality of life. There were some mentions of advocacy, early intervention, rehabilitation, signposting, and screening, and relatively few responses around disparity and inequalities and the wider determinants of health, but lots on kind of more specific clinical outcomes for specific conditions. So moving on to the next slide. And then when we looked at where are the priorities, we'd kind of merged some of those original themes that I put on the slide from the first workshop into these 6 areas. And we asked people whether or not these were important, how important they were, to rank them, and also if there were any others. So we didn't feel that we were missing anything, and this was the ranking. So they're written in order that the AHP community felt their importance. So developing the workforce was top, followed by social justice and health inequalities, raising the profile of AHPs, then going down to sustainability, using intelligence to show impact, and innovation and scale. So moving on. So here we are, the new strategic framework, which has been published this morning on the AHP Federation website in English and in Welsh. So if we move on to the next slide, what I'm going to do is just take you through that very briefly. So our vision for the next 5 years is that public health is a core part of all AHP roles, and that the positive impact on public health by AHPs is recognised and valued. And then moving on to the next slide. This is our new diagrammatical way of demonstrating what public health means in AHP practice. So in the centre, we have the traditional 3 domains of public health as used by the Faculty of Public Health. So that's health improvement, health care, public health, and health protection. And then wrapped around the side are the threads of sustainable healthcare and addressing health inequalities. So when we've moved on to our goals, we've got health inequalities and sustainable healthcare absolutely threaded through all of them, but equally that they are goals in themselves as well, because there are specific actions for each of those that we wanted to take. So moving on to the next slide, I'm just going to very quickly take you through our 5 new goals. So the first one remains developing the AHP workforce. So this builds on what we did in the previous 5 years. And we want to ensure that the current and future AHP workforce have the skills, knowledge, competence and behaviours to promote, improve and protect the health and well-being of not only individuals but communities and populations, and that we feel equipped to embed public health and prevention within the culture of the organisations and services that we work with, including workforce well-being. And on the next slide, I'm just going to go through a few of the specific actions that we want to focus on together. And that will be further in developing the pre-reg curricula, continuing to promote and develop and expand pre-reg public health placements, advocating for public health principles to be part of career development programmes at all levels, and what support we can provide for AHP leaders in order to optimise the public health contribution of the workforce. So moving on to goal 2, please Raggy. This one is about addressing health inequalities. So we want to ensure that AHPs are equipped to enable individuals and communities to have equitable access to care and health services without discrimination or prejudice, so that we will co-produce services with people, including marginalised communities and vulnerable groups, and work collaboratively with individuals to empower them to have choice and control over their health and well-being. And as I said, this is incorporated through all of our goals, but we've got some specific actions for this goal, which are on the next slide. and they are that we're going to support increased awareness across AHPs of what social justice, health inequalities, and equality, diversity, and inclusion mean in the context of their practice. We want to articulate and amplify the benefits to the health of the population of having diversity within the workforce, of using anti-discriminatory and inclusive practice. We want to enable AHP teams to understand more about their population demographics and the impact of the wider determinants on health, and so that they can design services, we can design services that ensure equity of access, experience, and outcomes. And finally, we want to share examples of good practice to support that scale and spread. So moving on to our third goal, and that is around sustainable healthcare. And here we were thinking about environmental sustainability, but also economic sustainability. So we want to continue to support AHPs to deliver interventions that minimise the negative impact on the environment and make effective use of resources to generate long-term stability for the current and next generation. And the next slide describes some of the specific actions that we want to take in relation to that. So again, we want to amplify the links and relevance between public health, health inequalities, climate change, planetary health, and environmental sustainability, so that it's clear that actions that we take in relation to one of those is impacting on the others. We also want to, with support of the Greener AHP programme, develop a self-assessment tool for AHP teams so that it's easy to see where we are now and what more can be done in relation to environmental sustainability. And finally, again, to collect and share good examples from practice so that we can learn from each other. So goal 4, moving on, is linked to promoting evidence, innovation, and improvement. So here we want to support AHPs to be able to demonstrate our contribution to improved outcomes from individual to population level through evidence-based practice. And that's really by making sure that we can use evidence, data, and intelligence and research in our decision-making and how we design models of care, but also how we demonstrate the impact of what we're doing. So moving on to the next slide in terms of some of the things that we're planning to do in this space. So we want to support an increased focus on population level outcomes and health inequalities as part of the research that AHPs do already. In the past, we did a Delphi study to look at what the research priorities were for AHP public health research, and we want to repeat and update that. We're wanting to develop a collection of evidence-based, high-impact public health interventions for AHP so that AHP leaders can speak with confidence about these are the things that will make a difference. We'll continue to work with the RSPH to maintain and develop the AHP Hub, and we want to champion some of the great practice that we're already doing through awards and conferences. And moving on to our final goal, goal 5, this is about leading and influencing in public health so that AHPs feel empowered to lead and influence across the entirety of the health and care landscape to improve health outcomes for not only individuals but communities and populations by developing public health leadership at every stage of their career. And the final slide in these bit will tell us how we're going to do that. So we want to increase the visibility of AHP leadership for public health. We want to develop a network of AHP public health leaders, including those who are not still practicing as an AHP, so public health consultants with an AHP background, for example, who will be able to support us in the work that we're doing and advocate for AHP roles in the public health space. We want to articulate the role of the AHP role in major public health priorities, including the health and wellbeing of the workforce, increase connections between public health leaders and AHP leaders to support collaborative working, and champion the importance of workforce wellbeing to ensure that AHPs ourselves are supported, but also to make sure that our skills are used in optimising the wellbeing of the working age population more generally. So moving on to the next slide, please, Raggy. So Overall, we know that as an AHP community, we're ready, able and willing to play our part in supporting a prevention-focused health and care system. And that's really important, as we all know, not only for saving lives, but for improving the quality of life, but also reducing healthcare costs and promoting health equity. And so just before I finish, I'd just like to thank on the next slide some of the people who've been really heavily involved in this. So Julie, I've already mentioned holding the pen on the development of the new strategy, but all the members of the Strategy Development Working Group and the UK Public Health Strategy Board, the public health leads in the 4 nations and the professional bodies, Janice, as I said, for her help, the AHP Federation for their support and publishing this document, our public health colleagues who've supported us, Judy for providing the secretariat, the chief AHP officers and their teams for supporting this on an ongoing basis, and to Caitlin and Raggy for hosting this event for us. And finally to everyone who took the time to help us to develop this new strategy, either through the survey or through providing comments and feedback. And I really hope I haven't missed anybody there, but thanks everyone for supporting this work. And I'll hand back to you now, Judith.
Thank you, Linda. Thank you, Linda. I'm just going to now introduce our next section, and we have, as I mentioned before, we're very fortunate to have the representatives from our 4 UK nation governments. And firstly, we will have Richard Evans, who is the chair of the Allied Health Profession Federation, where the strategy and the impact report are published. Followed by Professor Carolyn MacDonald, the Chief Allied Health Profession Officer in Scotland, and then Ruth Crowder, the Chief Allied Health Profession Advisor in Wales, and then Professor Michelle Tennyson, the Chief Officer from Northern Ireland, and Professor Suzanne Rastrick, the Chief Allied Health Profession Officer from England. And then finally, William Roberts, great to see you here, who is the CEO of the Royal Society for Public Health. And as Linda mentioned, we have a really strong working relationship with the Royal Society, and that will continue in a very positive way going forward. So over to you, Richard. Thank you.
Thank you very much, Judith, and it's a real pleasure to be here on behalf of the Allied Health Professions Federation. I'm Richard Evans. I'm the Chief Executive Officer of the Society and the College of Radiographers, and I also chair the Federation, which is, it does what it says on the tin really, a group of the professional bodies involved in allied healthcare. We are there to share expertise, to work together to promote allied health professional practice, to promote leadership and to advocate for better care for everyone through our members. So it's been a particular pleasure to host the UK-wide AHP public health strategies and the impact report, as Linda's just described, and really today to see on the AHPF website the new strategy which we're launching. I think everybody knows that AHPs sometimes feel it's a struggle to raise profile, but the area of health improvement, population health, sustainable healthcare is one of those areas where we, not only as individual professions, but as professions that advocate for each other and collaborate together as professionals with other health professions, but also within our teams, we refer to each other, we share expertise. This is particularly appropriate that the Federation is able to contribute in a small way by hosting this amazing work. It's great to see that there's positive impacts and that also the work that's being planned continues to aim to improve health in the healthcare workforce itself. That we know the stress that the system is under, the whole health and care system is under enormous stress, and that includes those professionals and their support workforces that work with them. So increasing health and well-being within the workforce is really crucial. Sustainability and advocacy for equality are things which are deeply at the heart of all of the allied health professions' strategies and aims for the future. So great again to see that reflected here, and what better message to say that healthcare itself across the whole of the UK depends on better population health. I really hope that the Westminster government is hearing this message loud and clear as it tries to work out a way to reach a sustainable healthcare system. That if we don't tackle population health, if we don't tackle health inequalities, then the system will continue to struggle. So we owe it to each other, to our service users, our patients, as well as our own members and professions to really be at the heart of this. So it's been a delight for the Federation to be involved. We strongly support the strategy. We will get the message out to all of our members and through our members to the population that AHPs are making a difference in population health, public health, health promotion, and we're all looking forward to a healthier future for ourselves, for our service users, and the whole of the UK. So once again, thank you so much for the opportunity to be here to take part in this. I'm about to hand over to the leads for allied health in each of the 4 UK countries, and I feel a little bit of an imposter, but it is great to be here. So I'm going to hand over to Carolyn, who's going to talk about Scotland and the impact of the strategy there. Thank you.
Thanks very much indeed, Richard, and hello to everybody. Absolutely delighted to be here, and I wouldn't have missed this for the world, because we are extremely passionate in Scotland, as you all are, around the impact that AHPs can have on the public health agenda. Before I go any further about and talk about the new framework, I really want to spend some time to acknowledge Linda Hindle and her leadership in herding cats, it seems like sometimes, in terms of getting us together across the 4 nations to absolutely embrace the opportunity for allied health professions to lead and innovate and continue to make a difference in this arena. So first of all, a big shout out to Linda and to Julie and others in the development of the current framework that we're launching today. In Scotland, again, I wanted to have a little shout out to Dr. Ruth Campbell, who is the AHP Public Health lead in Ayrshire and Arran, who has really helped us in Scottish Government to get us to where we are with regard to the current framework, and also our policy colleagues in Scottish Government, because we have an AHP Scotland Public Health Implementation Plan based on the existing framework, and we have got a part of the leverage that we've had with this plan is that we now have allied health leadership in every health authority in Scotland that comes on a regular basis to a board that I chair, the National Oversight Board, implementing the recommendations in our plan that's based on the current 4 Nations plan. So we've got a real infrastructure that's set up on the back of the original 2019 to 2024 plan. And that's a huge amount of work that's gone on over many years across the 4 nations, and also specifically in our individual nations, around raising the profile and making sure that AHPs are truly engaged and active in the public health arena. I think for us in Scotland, the public health agenda for allied health has given us real leverage in terms of making connections both within policy in our Population Health Directorate, but also externally with Public Health Scotland, with the Royal Society for Public Health and others. And it's great to see some AHPs in Scotland doing their Masters in Public Health, and also with regard to the AHP Career Fellows, who we've had some great stories from them recently, those who've had a specific public health focus, profession focus, specialty focus on the impact that they're making with the people that they see with regard to their input into public health. So the new framework not only reaffirms the vital role that allied health professions have across health and care, but in Scotland it closely aligns to the First Minister's priorities across Scotland that are eradicating child poverty, growing the economy, tackling climate change, and improving public services. So the current framework that we're launching today is hugely important, and by strengthening the role of the allied health professions, we're ensuring a more integrated, accessible and effective healthcare system, and one that can respond to the needs of a growing and diverse population. So together we can build a future where every person, no matter where they live or their circumstances, has access to the best possible care and support. So it's got a huge, significant positive impact for the allied health professions workforce. And I look forward to working closely across the four nations and with our AHP Public Health Board in Scotland to take this framework forward, and look forward to working again. So huge thanks to everybody for getting us to where we are today, and look forward to working with you going forward. Thanks very much. Handing over to Ruth.
Thank you so much, Carolyn. Bore da, good morning, everybody. I'm also equally delighted to be here today as we launch this critical framework, and I would like to echo Carolyn's words about the work from the team that's got us to this point. The previous framework, as Linda outlined, has set us on a strong path to build public and population health into our everyday practice. If you've looked at the impact report, you'll see just how much has been achieved. There is clear evidence and understanding that a traditional medical model approach to each individual does not sufficiently tackle the drivers of our population's ill health. It is not enough for us to keep treating people after they've become unwell when we know how we can prevent that by acting differently and earlier. Using our skills and our expertise to tackle inequalities, ensure sustainability, and promote that well-being of our population, we can effect better health for all. AHPs in Wales are already addressing the need to shift a greater proportion of our resources into prevention and early intervention, and reducing inequalities for individuals, communities and populations. And for several national public health priority programmes, AHPs play a key role already in achieving this change. So in Wales, we will focus all our collective energy on implementing this new strategy. And I'm really pleased to announce that from April, we will have a new full-time national AHP lead for public health and prevention. The post will be located in Public Health Wales and our national executive, and will provide the support and leadership to enable our AHP workforce to deliver the aims and actions of this strategy. Although this is a newly expanded post located for the first time in Public Health Wales and the NHS Executive, the role has been in place on a very part-time basis for a while. And in that short time, our amazing Judith John, who's chairing us this morning, has driven huge change in our approach to public health work as part of AHP's everyday practice. I would like to publicly thank her as she retires for all she has done to deliver in Wales and her work with the rest of the team. Again, thank you so much for all you've done across the UK to develop this strategy and get us in a strong position to drive this forward for the next 5 years. I think it requires a step change in our thinking of AHPs. While we will need to continue to deliver individual interventions to enable individuals to recover and treat ill health, our amazing NHS and social care system, as Richard outlined, cannot continue with the impact of population need because of lifestyle and societal inequalities and pressures. We have to understand how changing the system, culture and opportunities for all equitably is an equally essential role for us as AHPs in enabling our individuals to live well. I believe we must embrace the 5 ways of working set out in our groundbreaking Welsh legislation, the Wellbeing of Future Generations Act: prevention, collaboration, involvement, integration, and a long-term focus, embracing sustainability and long-term needs. This strategy shows us how we'll do that. So let's get implementing it. Diolch yn fawr. Thank you very, very much.
Good morning, everyone. I'm going to start by echoing my thanks to the Four Nations team in particular who have made this work possible. For me, it's a really brilliant example of what we can deliver when we work together. So we're absolutely stronger together as Four Nations in realising our vision. In the Northern Ireland context, a very big shout out for Geraldine Tegg and Heather McFarland from the Public Health Agency. This work comes at a critical time for us in Northern Ireland with a root and branch review of our Public Health Agency, which includes a challenging restructuring programme. So I genuinely value that Geraldine and Heather have prioritised this work and allowed us to contribute in the way that we have in Northern Ireland. So a very exciting milestone for us, and this work aligns very closely with my own vision for AHPs here in Northern Ireland, which is very much centred on creating a healthier and more equitable society. And the framework for me provides certainly me with a very clear roadmap in relation to how AHPs can further embed those public health approaches into every single aspect of the work that we do, not only in health, but also in the work that we do within our education system, within our youth justice system, and within our housing system in Northern Ireland. The framework also aligns very, very closely to the priorities that our Minister has set out, and he is very, very clear he wants to see us addressing health inequalities in Northern Ireland. He wants us to advance community-based care, and he wants us to build sustainable services. And what I really like about the framework is that it really links into the wider work that we are taking forward. And I think about our development in Northern Ireland of a rehabilitation framework, our ethical decision making framework, and indeed my own 5-year impact vision for AHPs. So I think all of these strategies will help us to proactively push a health system much more towards prevention, person-centered care, and tackling some of those really challenging root causes of poor health, and reducing the reliance, particularly on our acute services here in Northern Ireland. So next steps for us will be the more exciting process of implementing the framework, and I will be looking to my public health agency colleagues to again take the lead as they have done for the last strategy. And we are very much committed to putting all of our energies and resources into making this happen. And we want to do that because it's important. I mean, just keeping it simple. It matters. It matters to the staff. It matters to our people, and it matters to us. So we will be prioritising those robust governance and accountability structures. We will be focusing on driving new work, and we'll be focusing on celebrating some of the work that we already have in place. So measuring and celebrating impact is going to be key for all of us. So just to finish up, the framework for me is in many ways much more than a vision. It's a commitment. It's a call for action. It's ensuring that we will be, as AHPs, absolutely fundamental to the transformation of our health and social care systems. So work begins now, and I'm certainly fully committed to supporting everyone every step of the way. So thank you.
Good morning, colleagues. I'm Suzanne Rastrick, the Chief Allied Health Professions Officer for England, and I'd like to begin by echoing my colleagues' sentiments in terms of the exemplary four-country working that I think this demonstrates, and indeed the leadership that Linda Hindle and indeed Julie and Judith have brought to this process on our behalf. We're truly grateful for that. Thank you. As my colleagues have said, for all of us, this is a journey that we've been on. And as many of you know, I've been in post now for 10 years. And so from my perspective, this is an absolute core fundamental of our work in England. The first Allied Health Strategy for England we published in 2017 had in it a commitment to the health and well-being of populations and indeed the impact we have as allied health professionals to improve the health of well-being of populations and individuals. And that was undertaken by a crowdsourcing of we ourselves, largely of our registrants. But since then, we've moved forward in terms of the development of our second strategy, using a unique crowdsourcing arrangement which focused on the people and communities that we serve in the first instance, and then through thematic review, engaging the views of our community in terms of including our students and indeed our support workers, and then the wider professional networks that we have, including our professional bodies. And within that second strategy, there are very, very key planks for me around public health. So we have particular areas around people first and optimising care, but most importantly, in terms of the 5 new areas of the strategy, we have sections on social justice, addressing health and care inequalities, and indeed on sustainability and net zero, which Linda alluded to in her introduction. So from my point of view, that gives us a really fundamental platform that this segues to absolutely beautifully. The other thing in terms of the NHS England strategy, it has its own strategic policy, which is Core 20+5, and this really complements the work of that in reducing inequalities. So from my perspective, in terms of where we go from here in England with this now, in terms of implementation, we already have a strategic governance structure that holds me to account in terms of the delivery of our strategy and indeed this framework, as well as to Linda and my other 2 deputies, Steve Tolan and Beverly Harden. There's a real synergy with the infrastructure that we've developed with our regional leadership and indeed in our provider organisations around how we can use that to reinforce the messages that the framework has in it. The other pieces of work we continue to do are with our professional bodies, as Richard said, which is really important to us in terms of their engagement, and indeed with our regulator, with the HCPC, and in England, the General Osteopathic Council. The other thing I think that's really important is for all of us is around continuing professional development. And we continue to host a series of things like webinars, but also offering fellowships and indeed student placements in terms of an undergraduate level, so that colleagues such as Kyle can gain experience of, in a pre-registration sense, of that importance of public health to all of our practice. And the final area for me, which is really celebratory, that sort of cements some of this, is I have an annual awards, which we've had in place now for 7 years, and we have a very specific category for innovations in public health and around inequalities. And I'm really delighted to say that one of the winners of that category became our overall winner of AHP of the Year in 2023, and that was Samar Tang for his work in paramedicine. So I think from my perspective, we have a really good foundation in England which to move forward with. It's synergistic with NHS England's policies and indeed with that of the Westminster administration. But I think for me, what's most important is, as my colleagues have said, that this binds us together in terms of our work across the UK, where we've fought really hard as chief officers to maintain our commonalities in terms of our registrants and indeed on behalf of our residents, notwithstanding clearly that our administrations all have their own priorities and objectives. But from our perspective, in terms of allied health, this speaks the truth, which actually we are stronger together. And I'm really delighted now to hand over to the Chief Executive of the Royal Society for Public Health, William Roberts. Over to you, William.
Good morning, everybody, and thank you for inviting me. I love working with AHPs. I love spending time talking to you about the work you do. If I think back to last year, we launched a large piece of work on the wider public health workforce where we spoke to thousands and thousands of people, including AHPs, and we heard 3 things really loud and clear from those people. Firstly, that you wanted ways to get into a career in public health. Secondly, that once you got in, you wanted to be able to then develop that and get on. And then finally, you really wanted to be recognised. And I think listening today to the amazing work being done across the 4 nations and the work that has been done to pull this together, it really does speak to the power of AHPs in becoming a key and important part of our public health workforce in the 4 nations. If I were to think about the wider public health workforce, when we looked at who that is, nearly 1 in 5 of that workforce is allied health professionals, which means there is a huge opportunity amongst the professions to really think about how they can drive forward public health in the UK to create a healthier and more prosperous future. 3 things that particularly struck me about this brilliant piece of work. Firstly, the fact that you've been able to both embed early career development in pre-registration for public health for allied health professionals. And then secondly, that you've then been able to take on that by building further opportunities post-registration for allied health professionals to develop their public health careers is a model, I think, which we could roll out to a far greater number of professions across the United Kingdom. Secondly, the breadth of the scope within this is both challenging, but also deeply, deeply exciting. And I would encourage you to keep thinking about how you can push forward to do more in that space. And then finally, a commitment from us within this that we want to keep seeing AHPs as a huge part of the public health workforce, as a key part of driving forward prevention in the next 5 to 10 years in this country to really create a healthier and happier future for us. And our continued commitment to having the AHP Hub as something that you can access with resources that are there, free to use across 4 nations. Key commitment from us. Thank you so much for involving us in this work. Thank you so much for being part of the public health workforce. And I'm really excited at what the next 5 years could mean for us working together.
Thank you so much, William, and to all our speakers there who I hope, well, certainly have inspired everybody in their individual nations and across the UK as a collective. Before I introduce the next steps, just want to remind you, please ask some questions and use the Q&A function to post your questions, which speakers will be able to respond to just at the end. We have 15 minutes. So I want to now introduce Heather McFarlane and Geraldine Teague from Northern Ireland, who I know Heather very well because she has been very involved in the work across the UK, and a plug to read her very interesting report. Heather recently completed the Churchill Fellowship and has produced a report on AHPs and impact on reducing health inequalities. So an interesting read. Go to the Churchill Fellowship website for that. So I shall hand over to Heather and Geraldine to take us through the next steps and how you can contribute wherever you are in the UK, whatever job you're doing, AHP, support worker, student, get involved. Thank you.
Thank you so much, Judith, and good morning, colleagues. What an inspirational morning so far. It's been wonderful to reflect on the recent impact report of the previous strategy and appreciate really how much has been achieved by the previous 5-year work that each of us have been involved in right across the UK. It has really laid a very strong foundation for us as allied health professionals moving forward into this new 5-year framework. But I think instrumental to its success has been the 4-nation approach to achieving shared goals. And I'm wondering, Raggy, if the next slide, if the first slide could come up. Thank you. Instrumental to the success has definitely been the 4-nation approach to achieving these goals. This unique professional collective has comprised of representatives from England, Northern Ireland, Scotland and Wales, who share resources and aim to undertake work with outcomes that are really meaningful and transferable across the UK and all AHP professions. Going forward, the Strategy Board will continue to meet on a UK-wide basis twice a year with AHP representatives from each of the 4 nations and each of the professional bodies, and this will be part of our next steps. Each nation will have their own implementation plan to address the framework aims. And meeting together in this way provides an opportunity for progress and learning to be shared. And over the coming months, we will be developing new nation-specific and joined-up implementation plans to embed this strategic framework across nations and professions, and really importantly, to continue to share our learning across jurisdiction through informal meetings as well. And the implementation plans include how we will measure success in relation to each of the goals And we will continue to work together as we have done before in partnership with our professional bodies and other partners too to achieve agreed goals. It is, as many have said, a really exciting time ahead because we're going to explore new actions with a really strong focus on prevention, reducing health inequalities and protecting the environment. And we know that these are common threads running throughout the practice of many AHPs and colleagues as well in all parts of our health and social care system. But there are external services, agencies and departments too, who also contribute to these shared goals and ambitions, which is why you'll see in the framework, we have highlighted our aim to work beyond system boundaries to recognise those partners and strengthen outcomes by building even stronger collective approaches to reduce our health inequalities, improve population health and protect our environment. Next slide, please, Raggy. We plan to develop and share some specific pieces of work in the implementation of this strategy in the near future. But just as a taster and to build on what Linda has already shared, resources for our leaders. So just as an example, AHPs in England are developing a resource to support the optimisation of the AHP impact on the work and health agenda. Raising the health economic benefits of allied health professions in this arena is really timely, particularly in light of the recent focus of those experiencing long-term ill health and economic inactivity since 2021. In Wales, plans are afoot to support leaders in reducing health inequalities through the use of population health management approaches. And we know that reducing health inequalities is a national priority, and one which runs as a golden thread throughout this strategy. And it's vital that AHP contribution is recognised as part of the solution, because we are. AHPs in England will be gaining a consensus on the priority actions within each AHP profession to reduce the impact of our services on the environment. And this is hugely important as we see firsthand the impact of the climate crisis across the world. And anyone watching the news recently will appreciate that even more strongly. Nation-specific plans will embed sustainability as a key element of AHP roles further. Local resources such as NHS England Greener Hub, Public Health Wales Green Guide, all strengthen the sustainability role across our allied health professions. And we will have an increased access to public health placements. We know that our colleagues in Wales are due to report shortly on their scoping of practice-based learning opportunities, and future plans will be to build on this by increasing allied health profession student placements in public health across our regions. This list is not exhaustive, but it's designed to share some examples of outcomes aligned to the framework. And do expect to hear more from your local AHP leads or professional bodies as development starts on our nation-specific implementation plans really soon. And I'll hand over to Geraldine for slide 3. Thank you.
Okay, thank you, Heather. A very exciting morning, I must say. So really, we hope today today's launch has really enthused you all and left you motivated and also questioned what part can you play, regardless of your role as a frontline practitioner, as a team member, a manager, service lead, from an organisational point of view, or even as system leaders to support the implementation of this strategy. From today's launch, the resounding message is that this strategy requires everyone's involvement across all roles, wherever they may be, for it to be successful. Allied health professions are critical workforce in creating a healthier, happier, fairer and more sustainable future for all of those that we serve across the United Kingdom and in our individual jurisdictions. And we can evidence this with some very, very simple examples and really what we've picked up from the impact report of what we've achieved to date. So how do we support delivery of the strategy, making that difference is required, building on the learning from our previous strategy and setting the direction for this future, better, more equipped environment. And how do we deliver these 5 key goals set out within today's strategy, which we're launching? In developing our workforce, how do we develop it so that we understand the relevance and importance of public health and that focus on reducing health inequalities? In addressing health inequalities by co-producing and consolidating marginalised communities and those most vulnerable groups, delivering sustainable interventions and taking account on the links of climate, environment and the planet, looking and developing from what we've done before on evidence and innovation, and ultimately leading and influencing public health across the 4 nations, continuing to develop the connections. We have heard from our 4 Chief AHP officers and from William, we are stronger together. And as William alluded to, this is a huge opportunity for AHPs to support healthier, a prosperous future for all. In stepping forward, we need to do that at 4 different levels. Firstly, from an individual. So what can we all do at an individual level, regardless if we're a student, a practitioner, a manager, service leader? We can being sustainable in our own everyday practice, leading by example. And we can do that by promoting use of reusable water cup containers at work or meat-free conferences with lunches. And also from public health, making every contact count and really understanding what is the driver and the issues that our people that we work with are experiencing. At a team level, is adopting the public health strategy aims and goals into everything that we do, our team meetings, our agendas, encouraging our team to explore how we could change practice, listen to what our staff are telling us, and ultimately improve health inequity across looking at those waiting lists and the marginalised groups, how we can support the training, how we can embed it across our recruitment. At a national level, again, we've heard from our Chief AHP officers in how they're hoping to achieve this strategy going forward. And what we need to do is respond and share implementation actions. We've felt that from the first strategy. We've learned an awful lot across the 4 nations. And as Heather alluded to, the benefit of this is having that 4 UK nation approach. And this will come through your national representative. And again, if you don't know who that is, seek out and try and influence and keep close to them by publishing your practice examples on the website. And also then when we look at from an international basis, looking at exploring international opportunities, really to further help develop public health learning and practice through those funded fellowships, one of which that Heather has just completed, that may be available from our individual and very innovative professional bodies or wider charities such as Churchill. There can be huge gains in developing networks and shared learning through attendance at international conferences, so seek out alternative funding sources where possible. Not only by attending, but share that practice. It's really important that we all hear and learn and develop and explore global allied health professional alliance that's out there to reshape our practice that is aligned to our strategy from international platforms. Thank you.
So hi everyone. So I've been watching the chat for some questions. So Laura asks, is it possible to access and filter the data and results of the specific surveys that you've undertaken for the impact report? Would you be okay to answer that?
Yeah, I'll. So the work on that survey that you're referring to, Laura, was done by the Council of Deans for Health. So I will put my email in the chat because I know there was somebody else asking about that as well, and we can perhaps set up a conversation with the Council of Deans for Health to see what's possible to share within the what they said to people when they were collecting that data and what they were collecting it for and who they would share it with. So if we can do anything to share any of that with you to save you repeating work, then we will obviously try to do that. So I'll put my details in the chat so that you can give me an email separately. Thanks, Kyle.
And Jenny asks, is there any support/resources to support national implementation across Scotland? Carolyn, would you be okay to answer that?
Could you repeat the question, please?
Yeah, of course. So Jenny asks, is there any support/resources to support national implementation across Scotland?
So we have a national implementation oversight board. So there's representation from every board in Scotland. So I think if she can contact her AHP lead on the board, or we can set up a separate conversation, out with that. There's certainly a whole load of information and activity going on in each NHS board in Scotland based on the implementation plan, and we're delivering on all of the recommendations. So each board is doing things differently, and some of the boards are, absolutely sending case studies at the rate of knots to the Royal Society of Public Health to get them on the website. But there's a lot of information that's going on through our national board, but also specific locally. So I think it's probably best for a local conversation first, and absolutely happy to engage if there's no answer coming from that direction. Thanks.
Thank you. Liz asks, will you be continuing to work with professional bodies to inform research, strategy priorities / funding opportunities and other focuses such as the Priority Project Wales to drive the evidence and impact through AHP research development and embedding it into practice more strongly as a cultural norm? Richard, would you be okay to answer that?
Yes, thank you very much, Kyle. All of the professional bodies have research at the heart of our practice, and it has been really good, as we've seen from the results and the impact report from the first strategy, how much research around public health promotion amongst AHPs across the board has come forward. Each of us as individual professions clearly have specific priorities, but we're really happy to promote the opportunities that come up through Linda and her team, whether that and that is across the UK as well. So there'll be a certain amount where members of professions can look to their professional body and say, I've got these ideas, but we would also be looking to make sure that they're accessing resources from their local health economy, from their regional and national bodies as well. So it's a case of collaborating together, but we're really keen to see how that continues to grow as research is doing. I'm glad to say, despite the pressures on the system, we're seeing a great amount of research going on. So happy, really happy to see that, and we will, as individuals and as a federation, be looking to promote that. I hope that's helpful.
Thank you. So Helen asks, are there any resources which help build AHP's confidence starting conversations about different health topics? Could I ask Richard, would you be happy to answer that one as well?
Thank you. Yes, the AHPF as a federation doesn't have that kind of resource. I think it's very profession specific. Thinking about our own my own profession of radiography, yes, we are looking to use the nationally produced resources like the support workforce document that we heard about earlier, as well as our own strategic drive to make sure that radiographers are involved in public health conversations, and to take the opportunities to see where our profession can make a difference. What we have witnessed, and you can read some great examples from across the professions in the impact report. In fact, the innovation and drive of individual members is sometimes well ahead of what we as professional bodies are thinking about. So it's really important to spread that good practice so that we can help to share that from with our members to spark interest in what is possible in the public health arena, and I think this launch today is a great opportunity actually to point people to things like the Royal Society of Public Health website with all those terrific resources on there. To reawaken knowledge in our individual professions about the launch, what's possible, and where we should be going as professionals. Hope that's helpful.
Yeah, I'm happy to just pick up on that as well, Kyle. So there are a range of resources on the AHP Hub. They're available, they're publicly available, and they're free for people to download. What we've tried to do there is also to signpost you to other specific things, either for different professions or different sectors and nations where those exist as well. If you start with some of the case studies, that's a really good place to look at, because it's people talking about how they've done that in practice. There's then a range of other tools and resources on there. You can also go and have a play. We've got over 100 pages of content on there, so there's lots of different things. There's also the brilliant role descriptors which have just been developed in the last year, so we've worked with the teams to update those. They're available as well. And then there's a whole range of other things which, if people are interested, both through their professional bodies but also through ourselves at the Royal Society, which are available through membership. So lots of different things you can look at, lots of different places you can go. If people are interested, my advice would be start with the hub. There's lots of great stuff on there. We continue to update it, and I think a separate question has come in is how can people do that? There are ways through the hub to be able to place that, but also speak to your national reps, because they work closely with us and can help us to filter through some of that. So if people are interested, come to the hub as a start point. We've put it in the chat and we can stick it in there again. Great resources on there, lots of stuff that you can get into, lots of things to dig into, and feel free to get in touch with us if you think there are things missing or things you'd like to see more of as well. Thanks, Carl.
Thank you. So Pam asks, I think there is great value in joining up with those HPs working in primary care, as that's where the raw health inequality lies and where the biggest community impact can be seen. Is there a focus in primary care for additional roles? And I wonder, Linda, would you be okay to come in on that one?
Yes, happy to do that. So yeah, definitely. I mean, in England there's the additional roles reimbursement scheme, which increases the amount of AHP roles in primary care, and I think primary care is a perfect space to start implementing some of what we've been talking about today, because it's kind of that opportunity to be close to people and talk about the breadth of things that are affecting people's lives, linking to social prescribing, etc. So that is a perfect space to be doing this. But equally, in any other sector, you can see the relevance of how this fits in. So I'm hoping that answered the question.
Thank you. So Rebecca asks, with such a strong impact report from the previous framework and this inspiring new one, are we seeing increased interest and recognition from politicians and other decision makers of how AHPs can collectively improve the health of the UK? Richard, would you be okay to answer that?
Yes, I'm actually going off to a 10-year plan event after this, so I can ask what's happening. I'm sure, in fact, I know that allied health professional bodies and the AHPF have been, responding to the public consultation on the Westminster government's 10-year plan, and so there has been a push from the professional bodies and from individual professionals to really raise the profile of the importance of better health for all. We need a health system, not a sickness system, is the old cliche, but it's really true. but who knows the minds of politicians? I mean, each of the CHPOs may be able to either express frustration or give you good news examples of how you know, this message is getting across. I think it's a very hard message to deny, that we need to see better population health, we need to address health inequalities and all the things that are in the strategy. The drive for AHPs to be at the centre of that, it seems to me to be a fairly easy message to get across, and of course we want to see that have impact, and I'm aware that in giving this answer I'm sounding like a politician, which is really regrettable, isn't it? I'd like to say yes, it's great that there's lots of evidence that this message is getting across. I don't see that yet, but I'm really hopeful that as some plans about the future of healthcare come out, and policy plans, not only from the Westminster government, but in the devolved nations, we will see a growing and increasing recognition that if we don't get public health right, then actually the whole system becomes less and less sustainable. And I'd like to see, of course, that AHPs are recognised for our roles in those policy statements.
Thank you. So I think that's all we've got time for, but thank you everyone for your questions, and it's really amazing to see all the positivity in the chat as well. So thank you for that. And I'll hand back off to Judith.
Thank you, Kyle, for coordinating that, and we were glad to have some really useful questions. If I could just have the last slide up, Raji. Thank you. So all I've got to say now is thank you for coming. We've had a tremendous participation, I think nearly 170, I think, in total at the beginning. So it was really just to say, wow, we're really pleased you've come along. Please share this with your colleagues. We will be sharing a recording of it within our 4 Nations, so look out for that. And just really to say, a summary of what everybody said this morning is that AHPs have a pivotal role to play in reducing health inequalities, engaging the population in healthier lifestyles, and delivering sustainable healthcare. So it's now for us to work together across and within our nations and as an AHP community to realise this vision. So thank you on behalf of everybody who's contributed to today's event. It's inspired me so much I think I might reapply for my job, but I'm very happy that it's I'm leaving in such a positive way. So all I've got to say now is thank you very much, diolch yn fawr, and guru ma agut in Gaelic. Thank you so much.